Health Director Sigalle Reiss also commented on the changes made to the vaccine distribution and gave some insight on how this will affect the town of Norwood.
Yeah, well, there's definitely restriction on and a limitation on the amount of vaccine that the state is getting. We have, as a whole, a larger capacity to vaccinate than the amount of vaccine that we're getting. So from the state perspective, it's more efficient to send all their allocations to the mass vaccination sites. For us on the local level, I think we want to stress the importance of it's not one or the other, that we can, hopefully have both. This is something that local health departments, including here in Norwood, have been training for and planning for over 15 years. We have received a lot of state and federal money to stand up these plans and think about how we would vaccinate our population. We have a whole plan to work at the senior center, and actually the new high school is our backup site, working with volunteers, working with the school nurses to set up many stations of nurses and to actually have a much bigger throughput. We haven't been able to implement any of these plans because we've been getting such a small allocation of vaccine. But plans include everything from the supplies we need, the logistics, how we're going to store the vaccine, how we're going to administer it, who's going to administer it, how quickly we can do it, which target populations we can reach. So there's a lot of logistics that goes into planning a vaccine, and it's a big effort, but it's something that local health really wants to do, and it's our job. That's how we take care of our community. It's one of our main functions. From what we understand, we will still get our second dose allocations. So I do expect that we will be able to meet the demand for the second dose. Again, everybody that got their first dose from one of our clinics should be able to get their second dose. At this point, that looks like the plan. As I say, throughout the response to this pandemic, things are constantly changing, and we'll get the message out as soon as we can if we know things are different.